coming to the lesions of the spinal cord. Now, what will happen to the spinal cord if there is damage? Okay, so we classify the lesions of the spinal cord as transection of the spinal cord and specific sensory disturbances and specific motor disturbances. Okay, so first we will see about the transection of the spinal cord. In that we can classify that as complete transection and incomplete transection, and one main division of the incomplete transection is hemisection. Okay, so we'll see about these three lesions, and also we will see in detail about certain sensory disturbances like syringomyelia, tabes dorsalis, subacute combined degeneration of the spinal cord, cauda equina syndrome. So all these are specific sensory disturbances. Specific motor disturbances includes upper motor neuron lesion and lower motor neuron lesion. Okay, so upper motor neuron lesion, if there is any problem or any lesion from the origin of the motor neuron, say for example from the cerebral cortex motor area 4, 6, 3, 1, 2, from its origin till its synapse in the spinal cord. Okay, so anywhere lesion, anywhere in this range is called as upper motor neuron lesion. Lower motor neuron lesion starts from the anterior horn cells and its nerve fiber course downwards. Okay, so that is lower motor neuron lesion. Lower motor neuron lesion may be present in the spinal anterior horn cells, or maybe an injury to the peripheral nerve. Okay, or maybe even an injury to the muscle itself. So all these are lower motor neuron lesion. We'll see about the complete transection of the spinal cord. This complete transection, as the name literally denotes, there is complete cut of the spinal cord. Okay, so this can happen whenever there is an gunshot injury, or maybe a road traffic accident which involves dislocation of the spine, or maybe a occlusion of the blood vessel that supplies a particular part of the spinal cord. It must be a major occlusion. Okay, so these causes will lead on to the complete transection. Now the transection, after the transection, what will happen to the patient's sensory and motor function? There are three levels of transection. Okay, so there are three stages as such. The stage of spinal shock, then the stage of reflex activity, and the stage of reflex failure. Okay, so the stage of spinal shock is nothing but immediately after transection, what happens to the sensory and motor functions. Then stage of reflex activity, how this motor functions and sensory functions are regained after a period of time. Then comes the stage of reflex failure, where again if the patient's general condition is deteriorated, then he may go on for the failure of recovery. Okay, we'll discuss stage by stage. First, the stage of spinal shock. This is also called a stage of flaccidity. That means there is no tone of the muscles in this stage. Okay, so the patient actually feels that as if he is cut into two halves. Upper half will be normal, and he can feel and he can move the limbs and completely normal. Okay, so the lesion, the part of the body above the lesion will be completely normal. Okay, whereas the lower portions, the part of the lesion below the particular lesion will be deprived of all the functions, including sensory, motor, autonomic, every function will be lost. Okay, so this is the stage of flaccidity which will be present for a small period of time. Characteristic feature of this stage is there will be complete paralysis, flaccid paralysis. That is, the tone is completely absent in the muscles in the affected regions. Okay, so there will be complete flaccid paralysis of the muscle below the lesion. If the lesion is at the cervical level, then there will be paralysis in all the four limbs. That is called as quadriplegia. Okay, so quadri means four. All the four limbs get affected. That is quadriplegia. If the paralysis or if the lesion is at the thoracic level or below, then the lesion will cause paraplegia. That is, only both the lower limbs will get affected. Okay, so that is the most important feature in this stage. And there is, as the name flaccidity indicates, there is complete loss of muscle tone. There is complete loss of all the reflexes, whether it is superficial or deep reflexes, complete loss will be there, and all the sensations will be lost below the level of transection. This is what is happening in the stage of spinal shock. And two important other features is the urinary bladder and the rectum. These are the smooth muscles that are controlled by the autonomic nerve fibers, sympathetic and parasympathetic nerve fibers, especially the sympathetic nerve fibers. They are also getting paralyzed, and after some time, the sphincter activity alone recovers rapidly. So there occurs retention of the urine. Urine gets filled and it gets stopped, retented, but they will not be able to evacuate the urine voluntarily. Okay, so that happens. The other important finding is this changes in the blood pressure. That is the vasomotor fibers, which are the sympathetic fibers which originate from the level of T1 to L2. If it get affected due to the lesion, then what happens to the BP? If the transaction is below the L2 level, there is no change in the BP. Whereas if the transaction is between T1 to L2, then marked fall in BP will be seen. Okay, so these two are the additional changes that have to be noted in the stage of spinal shock. This duration of the spinal shock is dependent upon the degree of encephalization. In mammals, especially in human beings, the encephalization is far extended. So this spinal shock also will be lasting longer. In mammals and especially human beings, it is for 3 weeks. In frogs, it is only for few minutes. If you have a pithing of if you do the pithing of the frog, then within few minutes, the stage of spinal shock will wane off. Okay, and for cats and dogs, it is for few hours. Then comes the stage of reflex activity. Now, what happens? The muscles, they regain their tone slowly. Okay, first muscle to regain their tone is the smooth muscles of our body. They gain their function first. So initially in the stage of spinal shock, there was only urinary retention. Now spontaneous filling and voiding will be happening. So there will be reflex evacuation of the urinary bladder and rectum will be happening as and when the subject's urinary bladder or the rectum gets filled, it will be evacuated. Okay, this happens spontaneously, but still the patient will not be able to control the bladder or the rectum. That is one difficulty in this stage. Okay, then again the next thing is the sympathetic tone of the blood vessels. They are also regained, so the blood pressure comes back to normal. And slowly the skeletal muscles regain their tone over a period of 3 weeks to 4 weeks. Okay, but again in this, there is an order. First muscle that gets its tone back is this flexor muscles. So what happens? The flexor muscles start contracting. So the body will be in a flexed position. That is why it is called as paraplegia in flexion. Okay, so their arms will be flexed. Their knee joints will be flexed. Okay, so there will be plantar flexion. Dorsal flexion, dorsiflexion, everything will be in the flexion. So this is called as paraplegia in flexion. Okay.